Intensive care specialist and anesthetist. Today I want to talk an important topic. The topic's name is, just you can see, there are some drugs like omeprazole, pantoprazole, ranitidine. I think every house nowadays has these medications. Every house is full of this pantoprazole, esomeprazole, rabiprazole, or ranitidine. We call them Rantac, Pantop, Omage, etc., etc. Every house is full of these medications. So the thing is, whenever the patient is having slight indigestion, or whenever any person has got slight indigestion, or anything like acidity, little acidity, or whatever may be the complaint, any small thing inside the chest or behind the chest, they immediately take one pantoprazole or one omeprazole or one Rantac, and they go on repeating. So this is what is happening in everybody's house. Whenever I get a call on this such problem, I try to tell some medication. They say, just now I have taken one Pantop or one whatever it is, one Rantac or whatever it is, these medications. So it has become routine, just like you take Crocin or Dolo. This is paracetamol. Paracetamol can be at home always because it is very safe drug, safest drug available right now. So these medications are being taken very routinely, which are very dangerous. I wanted to tell you mainly on that. These medications are not safe. They are very dangerous because they can cause long-term effects. For example, this ranitidine drug, they are called H2 blockers. So they control the acidity. They reduce the acidity. They reduce the production of hydrochloric acid in the stomach, so that in future there are incidences of echlorhydria. There is no stomach. There is no acidity. There is no acid in the stomach. It is very dangerous. These things lead to some other problems. Don't go for such things. My advice is, always, suppose you have some acidity, always keep, I think we are all aware of the medication by name, some orange color chewable tablets will be available, like previously it was Digene, some Gelusil MPS. These are the medications to be taken because they are clear antacids. Temporary medication. These are temporary medications. Just suppose you have some acidity or some uneasiness. Try to chew about 3 or 4 tablets of Gelusil or Gelusil MPS or Digene or whatever brand which you like, whichever is available with you. Always keep 1 or 2 strips at home. Don't try to have this pantoprazole, ranitidine, omeprazole, because these are Digene and Gelusil MPS, which are chewable tablets. You need not chew them. You can just make in or you can just make it into pieces and you can take it also. Very simple. And there are liquid also, but liquid you cannot store for longer time, because once you take some Gelusil MPS or Digene liquid, once you open it, generally any bottle, any syrup, once you open, you have to use within a period of about 2 weeks. Not more than 2 weeks. You can keep it at home, even if it is refrigerated. That is my advice. Don't go beyond that. So you always better try to have tablets which have long expiry dates, Gelusil MPS or Digene or some other brand, whichever you like. So only thing is, chew them. Immediately you will get relief. Don't take pantoprazole, omeprazole, ranitidine, etc., whatever it is, because these medications are meant for some other problem, like ulcers in the stomach, or some acid reflux syndrome. These are given only after diagnosis by gastroenterologist or physician, or after doing endoscopy. These medications are put on patient for about 1 month or 2 months, sometimes on long term, but not for occasional use, like we use Dolo or Crocin for headache. This is not a tablet for that. Be careful. This is very important thing. Don't neglect it. Be very cautious about this. You can take Gelusil or Digene. Always keep at home. You can chew the tablets whenever there is acidity, but don't go for these medications. That is my request. Always do it.